Did you know that spending at least 120 minutes a week in nature is associated with good health and well-being? How do you feel while watching this video? How do you feel when you are outside with nature? It is known that just being in nature, just watching nature can drastically reduce anger, fear, stress, and increase pleasant feelings. Nature heals, soothes, restores, and connects. Nature truly is the best medicine. With that, my name is Arianna, and I'm a student at the University of San Francisco, and today I'm going to be discussing how gardening, also known as horticultural therapy, can delay or even slow the progression of dementia. But before I begin, let's get into some background. What is dementia? Well, according to the Alzheimer's Association, dementia is not a single disease, it's an overall term like heart disease that covers a wide range of specific medical conditions, including Alzheimer's disease. Look at the figure to the right. All these disorders are grouped under the general term dementia. All are caused by abnormal brain changes, and these changes trigger a decline in thinking skills, also known as cognitive abilities, severe enough to impair daily life and independent function. They also affect behavior, feelings, and relationships. Many different types of dementia exist, and many conditions cause it. Alzheimer's is the most common type of dementia. About 60 to 80% of people who have dementia have Alzheimer's. It happens when proteins called plaques and fibers called tangles build up in your brain and block nerve signals and destroy nerve cells. Vascular dementia is the second most common type. It accounts for 5 to 10% of dementia cases. In vascular dementia, there's not enough blood going to your brain, and this can be caused by damage to your blood vessels or blockages that lead to many strokes or brain bleeding. Frontal temporal dementia accounts for 5 to 10% of cases. This form of dementia involves the loss of nerve cells in the front and side areas of your brain behind your forehead and ears. Personality and behavior changes and trouble with language are the main symptoms. Dementia with Lewy bodies accounts for 5 to 10% of dementia cases. Lewy bodies are abnormal clumps of protein called alpha-synuclein. They build up in your cortex, a part of your brain that handles learning and memory. And last but not least, sometimes a person has brain changes caused by more than one type of dementia, and this is called mixed dementia. Prevalence. Again, according to the Alzheimer's Association, more than 6 million Americans are living with Alzheimer's, and by 2050, this number is projected to rise to nearly 13 million. In the United States, Alzheimer's and dementia deaths have increased 16% during the COVID-19 pandemic. The number of Americans living with Alzheimer's is growing and growing fast. Alzheimer's is not just memory loss. Alzheimer's kills. According to the Alzheimer's Association, 1 in 3 seniors dies with Alzheimer's or another dementia. It kills more than breast cancer and prostate cancer combined. But what if there's a way to slow the progression of dementia or reduce the risk of dementia? Unfortunately, there is no cure for dementia, but a growing amount of evidence shows that there are things you can do to help reduce your own risk. These include keeping active, eating healthy, and exercising your mind. Horticultural therapy, also known as gardening, include all those things and can delay the progression and reduce the risk of dementia. Well, before I begin talking about a recent article, let's break down what horticultural therapy actually is. According to the American Horticultural Therapy Association, horticultural therapy techniques are employed to assist participants to learn new skills or regain those that are lost. Horticultural therapy helps improve memory, cognitive abilities, task initiation, language skills, and socialization. In physical rehabilitation, horticultural therapy can help strengthen muscles and improve coordination, balance, and endurance. In other settings, gardening can help people learn to work independently, problem solve, and follow directions. Specifically, the article I'm going to be talking about is titled Gardens May be Therapeutic for Dementia Patients, published by the Smithsonian Magazine, and this article focused on explaining the results of a recent study from Ware and colleagues, 2014, that looked at 1, what is the impact of gardens and outdoor spaces on the mental and physical well-being of people with dementia who are resident in care homes? 2, what are the views of people with dementia, their carers, and care home staff on the value of gardens and outdoor spaces? And just as the article's first sentence states, taking time to smell the roses is good advice for just about anybody, but it is particularly good for dementia patients. Interestingly, there has been no previous attempt to evaluate the evidence of the therapeutic impact of gardens or outdoor spaces for people with dementia who are resident in care homes. Researchers looked at a variety of studies done on the topic and found that there are promising impacts on levels of agitation in care home residents with dementia to spend time in a garden. Agitation is one of the most difficult symptoms of dementia for patients and caregivers alike. It is extremely vital to look at how to reduce agitation in patients without resorting to drugs. And one avenue that some nursing homes are exploring is aromatherapy, while others, as this new study suggests, are turning to nature. And you may be wondering, well, how can a garden do this? What makes a garden therapeutic? Well, from the study, benefits of the garden were thought to occur through two mechanisms: reminiscence and sensory stimulation. The evidence suggests that these mechanisms work partly by encouraging a relaxing and calming environment while also providing an opportunity to maintain life skills and habits. This is in part supported by other research that suggests that merely viewing nature can reduce stress and anxiety. Other studies also have suggested that physical activity may have a role in slowing cognitive decline and in reducing falls, both of which happen in the garden environment. Current guidelines for dementia recommend that specific attention should be paid to the physical environment where people with dementia live, including the design of and access to gardens, indicating that gardens may be a strong element in future care. In fact, focusing on one article from the Systemic Review from Rask and colleagues' 2010 study, the purpose was to conduct an in-depth evaluation of the impact of the construction and use of a garden on resident quality of life in a rural nursing home. This qualitative study used interviews with residents, family members, staff members, and community volunteers who built the garden, and findings suggest that the garden had positive effects on resident quality of life, particularly in terms of meaningful daily activities, enjoyment of daily life, resident relationships, and functional competency. Here is a resident at the garden view picking flowers. Note the mailbox as a reminiscence tool. Here is a mother on the right and daughter on the left planting flowers in the memory garden at the Sunshine Center. These are two residents of the Sunshine Center participating in planting and weeding. One interview from a nurse at the Sunshine Center explained that we had a resident who refused to eat, and she wanted to be outside. She would like to lie on the grass and pick flowers. We had a really bad day once, and she really hadn't eaten all day, and it was dinner time. She still wasn't eating, so I said, "Let's go outside." We went outside and sat in the gazebo, and I took her dinner there. We sat out there and talked about the different trees and picked up a few leaves, and she calmed down enough to agree to eat. The fact that the outdoor space, might help not medicate somebody, that it means putting someone in a better mood when you're not in the mood to eat, that means feeling better about themselves and eating. That's pretty beneficial. And you go on and forget your troubles. It takes you outside. It takes you in another dimension of life. There's a real world out there beyond the walls. Residents or those suffering with dementia in general who are not in nursing homes without a garden space to look out onto or walk into miss out on a vital component of nature: sunshine, fresh air, an opportunity to socialize, and even the opportunity to get their hands dirty, which may result in reminiscence and maintenance of physical and mental abilities. As one of the staff members noted, garden and outdoor space symbolizes life. Until a cure is found for Alzheimer's disease and other forms of dementia, a more non-pharmacological approach to therapy, including therapeutic gardens, can improve the quality of the environment by incorporating nature into the equation. And just as the study states, the garden is a metaphor for life. Just as the soil rejuvenates the plant and supports its growth through the plant life cycle, the design of the garden supports the resident or person with dementia through their human cycle, connecting them to the reality of their own mortality in a non-threatening and natural way. How can all this information relate to you? Keeping physically and mentally active in middle age may be tied to a lower risk of developing dementia decades later, according to a study published in the Medical Journal of Neurology. Mental and physical activities included gardening, so start early because you won't regret it. But why is this all so important? Well, one thing that I've learned in my physical activity and aging class is that dementia and aging is yet another crisis. It is going to keep evolving. Unless there is a treatment to slow, stop, or prevent the diseases developed, in 2050, Alzheimer's is projected to cost more than $1.1 trillion. But forget about the money. Think about how millions of people are affected by Alzheimer's or some form of dementia annually, and how millions more will be affected next. Behind these numbers is a hidden and very real human cost to the family caregivers and other carers who help those with dementia go about their days. This can be your mother, father, grandparent, neighbor, friend, or just anyone. Another thing I've learned in class is that cognitive issues are lurking for most older adults. It is no doubt that our brain, like the rest of our body, changes as we grow older, and many people notice gradually increasing forgetfulness as they age. Scientists and clinicians describe 3 stages in the development and progression of dementia: the preclinical or pre-symptomatic phase, mild cognitive impairment, and dementia. MCI is considered an intermediate stage between the expected cognitive decline of normal aging and the more serious decline of dementia. It can involve problems with memory, language, thinking, and judgment that are greater than normal age-related changes. So preventing further decline is key, and as we know, gardening is one thing that can help prevent or slow the decline of dementia. And of course, saying that putting gardens in nursing homes could help residents is one thing, but as the authors of the study note, implementation is much more difficult. Staffing shortages and security protocols designed to keep residents safe might limit their ability to access a garden. Gardens may also not be accessible for those with dementia either, who are not living in nursing homes. Despite this, starting small is key. Perhaps adding a plant or just being outdoors can help. Remember, dementia is a family disease. It takes a toll on the patients, carers, and loved ones. Watching dementia progress is painful and quite devastating. The need to implement solutions to stop or slow or mitigate symptoms, or even the progression, is direly needed. The availability of gardens or outdoor areas in residential homes, nursing homes, hospitals, or any homes may offer a range of benefits for people with dementia, including opportunities for active engagement with gardening, walking in an outdoor environment, and sitting in soothing surroundings. If this is what it takes to reduce agitation, reduce the progression of dementia, and improve well-being for everyone, why not implement it? With that, I want to leave you with this. Think about how those with dementia transitioning into the next stage of care and how it must be daunting and stressful. I think it is worth asking how we can make that transition easier and what can be done to make people affected by dementia feel more at home, happier, and healthier. How can we create a calm space that triggers happy, familiar memories? And it seems to me that gardens are the answer, always. Thank you for listening to my presentation. I hope you enjoyed it and learned something new. And here are my references I used.